Hi everyone, welcome to my week 4 industrial training vlog here in Surabaya, Indonesia. For this week's vlog, I will be sharing my experience related to patient-centered practice, specifically my experience communicating with a patient during a cardiac CT angiography. The most significant clinical experience I had this week was assisting with the preparation and communicate with a patient undergoing a cardiac CTA examination. I found this experience interesting because cardiac CTA requires a good patient cooperation. The patient needs to remain still and follow specific breathing instruction during image acquisition. Therefore, I had the opportunity to observe and practice how to communicate this instruction clearly to the patient before the examination started. The most important thing I learned from this experience was that patient communication for cardiac CTA starts even before the actual scan. At Rumah Sakit Universitas Erlangga, we need to ask the patient about their keluhan, which means their main complaint, and explains to them and make them understand why they need to undergo a cardiac CTA. We also need to make sure that the patient meets the requirement for the examination. For example, the heart rate needs to be controlled, usually below 70 beats per minute, because a lower and more stable heart rate can help reduce cardiac motion and produce a clear images. Besides that, I learned that the importance of giving clear breathing instructions. Before the scan, we need to explain to the patient when to breathe in and when to hold their breath during image acquisition. The patient needs to understand and follow this instruction because movement or incorrect breath holding can affect the image quality. The most challenging aspect for me was making sure that the patient could understand and follow the breathing instructions correctly. This was also related to the language barrier that I have experienced during my training here. Some patients mainly speak Japanese. Although I can communicate in Indonesian, there are still some words or expressions that I may not understand. Because of this, I had to use simpler Indonesian, speak more slowly, and sometimes demonstrate the breathing instruction to the patient. For example, I usually tell the patient, nanti ketika saya bilang tarik nafas dalam-dalam, kemudian tahan nafas dan jangan bergerak sampai saya bilang boleh bernafas kembali. I also learned that I should not just ask the patient whether they understand. I need to observe their response, and if they look confused, I will explain the instruction again in a more simpler way. This experience was important because it made me realize that patient-centered care is directly connected to the technical quality of the examination. In cardiac CTA, patient movement or incorrect breath holding can affect the overall image quality. Therefore, communicating effectively with the patient is not only about making them feel comfortable, it also helps us obtain good diagnostic images. I realized that as a radiographer, I need to consider the patient's ability to understand and follow instructions rather than simply focusing on completing the examination. This experience relates to what I learned in class about patient communication and cardiac CT. In class, we learned that we need to give clear breathing instruction and make sure the patient understands what to do during image acquisition. However, in real clinical practice, I realized that communicating the instruction is not always as simple as it seems. For example, during a cardiac CTA, a patient may feel nervous because they are unfamiliar with the procedure or worried about the contrast injection. When the patient is nervous, they may have difficulty concentrating or following the breathing instruction correctly. In this situation, I learned that I should not simply repeat the instruction or just tell the patient to hold their breath. Instead, I need to stay calm, reassure the patient, and explain back to them the instruction step by step. For example, I can tell them, Pak, tidak perlu khawatir, nanti saya akan beritahu kapan harus tarik nafas dan tahan nafas. Ikuti saja instruksi saya dan pemeriksaannya hanya sebentar. This made me realize that the communication skills we learn in class are not only about giving the correct instructions. In real clinical practice, we also need to consider the patient's emotions and adapt our communication to make them feel comfortable and confident enough to cooperate. For improvement, I want to become more confident when communicating with patients during cardiac CTA. I also want to learn more simpler Indonesian and Javanese phrases that are commonly used in the radiology department. Most importantly, I want to practice giving breathing instructions clearly and confidently before the scan starts. Next time, instead of simply asking whether the patient understands, I will try to confirm their understanding by asking them to practice the breathing instruction with me before the actual scan. This can help identify any misunderstanding early and make the patient more prepared and comfortable during the examination.